everybody. Happy St. Patrick's Day. We are so excited to have Matt here to do our presentation today on everybody's favorite topic, HIPAA. Well, it's my favorite topic because y'all know I'm kind of a geek when it comes to compliance. And I will say that I'm forever grateful for the powers that be in the universe that brought Chris, he works with Matt, into my life so that he could just wow me with his compliance knowledge and a really incredible product. But we're going to talk about that later. So Matt is the president and co-founder of Abide, an industry-leading software company that specializes in HIPAA compliance. Y'all, it is unreal. But Abide is an automated, cloud-based software solution that is revolutionizing the way providers attain and sustain internal HIPAA programs. And let me just say, it's like the easy button for HIPAA. But anyway, with a multifaceted background in healthcare IT, Matt has a unique perspective of the challenges independent practices face when attempting to adhere to government-mandated privacy and security rules. So I'm super excited for us to get started. And also because I know a lot of y'all have been emailing, calling in. Obviously, y'all see we're working from home. But the ChiroHealthUSA office is still open, and we are going to be sending out a mass email to everybody on some tips to help you get through the coronavirus and the crazy world that we are all living in right now. So now I'm going to be quiet, and I'm going to turn it over to Matt. Thank you for being here.
All right. Well, thank you so much, Christy, for the warm introduction. And good afternoon or good morning for those on the West Coast. As Christy mentioned, my name is Matt DiBlasi. I'm president and co-founder of Abide. Really honored to be here with you today. I'm extremely excited that each of you decided to join today's educational HIPAA compliance webinar. I mean, obviously, as Christy was mentioning, with what's happening with the COVID-19 virus, I can understand and appreciate how everyone has been affected and inconvenienced. Actually doing a webinar is quite wise these days. So it really lined up great, but I know you've taken time out of your busy day to join us. So I just want to say thank you. I'm going to do my best to make sure you get as much value out of today's webinar as absolutely possible. And I'm really confident that's the case. Now, as Christy mentioned, I've been in the healthcare industry for more than a decade now. I can absolutely understand that many of you out there treat HIPAA like it's a four-letter acronym. Or I'm sorry, a four-letter word rather than a five-letter acronym, if you know what I mean. And so if you're like most practices out there, you'd rather pay attention to probably literally anything else than HIPAA requirements. But rest assured, by the time we get done with today's webinar, you'll have all the information that you need to comply with these complex healthcare privacy laws. Now at Abide, we understand that HIPAA, it absolutely can be overwhelming at times. So we put together this webinar in partnership with ChiroHealthUSA to help overcome the challenges that HIPAA can present to the chiropractic industry. And so I'm going to arm you with all the information you need to not only protect your patient's sensitive information, but then also to make sure that you understand what's needed to pass an audit. And by the end of today's webinar, you'll really see how protecting sensitive data and passing an audit, HIPAA audit specifically, or investigation will go hand in hand. Now at Abide, our mission is really simple. It's actually just to revolutionize HIPAA compliance. We do that a lot of different ways, as you'll see during today's presentation. So one way we love to do this is we love to have interaction between our participants and educators, because we do webinars on a regular basis. And today, because of the size, it might be a little tough for us to let everyone have an opportunity to speak, but we will be offering a question and answer session at the end. And I've got some of my colleagues, Chris Wheaton, who's our Vice President of Sales and Strategic Partnerships, and Tori Jeffcoat, who heads up our marketing department, joining us, and they're going to help me sift through any questions and answers that we need to at the end. So just hang tight. If we get an opportunity at the end, I'd definitely be willing to answer as many questions as possible. In addition to that, we're also going to make today's presentation interactive. So I'm going to need everyone to take out their phones right now. I want you to go to kahoot.it. And I've got a slide for you here. And I want you to put in this 7-digit code when you get to kahoot.it. And this is going to give us a little opportunity to get some feedback from you. Oh, hold on. I guess, let's see, maybe my screen is not showing. Hold on one second. I've got it, unless there's an issue, I'm showing on my webinar jam here that my screen is showing. So hopefully it's showing for everybody else. But Kahoot.it, enter that pin. I'm going to give everybody just a minute here to jump on there, but it's going to give us an opportunity to be interactive, get some feedback from you.
Matt, I can't see your screen. You may have to restart the screen share.
Interesting. All right, let me just try that. 1 second.
Oh.
How about now?
I can see it.
All right, perfect. All right, so we're going to get real-time feedback from you as the audience. I'm going to give just like 5 more seconds here to let you get that set up, and then we'll go ahead and get started. All right, now my first question for everybody is, what does the HIPAA acronym stand for? So you have 4 options here on your screen. Just correlate your response with the color and the shape that you see there, and we'll give everybody just a few more seconds. So we'll actually share these results with you as we go through the presentation, so you get an opportunity to see who else did or didn't get it. Don't be afraid if you don't know the answer. Take a guess. About 95% of our participants really can't tell us what it means, so just take a shot at it. All right, so the Health Insurance Portability and Accountability Act is exactly what HIPAA stands for. So the ironic thing here is that if you were to ask me what the HIPAA acronym actually describes about your roles and responsibilities as a chiropractic office, the answer is absolutely nothing, right? This actually is a great example of how confusing can be. The acronym doesn't provide any insight of what must be accomplished to comply with these regulations. Now at Abide, we like to focus on the word act. And so I think many practices today would actually take HIPAA more seriously if they understood how to implement the appropriate action plan for their HIPAA compliance program. So today I'll put the pieces of the puzzle together for you and lay out a practical path to compliance for your practice. And just a side note, as you see here on your screen, a lot of the practices that we have joined our webinar are surprised to see that HIPAA is a law. You can see that mentioned on your slide here. So let's see how everybody fared with the results. I'm just going to pause my screen here. 1 second. And we'll get some results on how everybody fared with HIPAA compliance. So as you can see here, the majority of practices guessed incorrectly. So the Health Information Privacy and Accountability Act actually makes sense, as we mentioned before, but Health Insurance Privacy and Accountability Act is actually what we were looking for. Or I'm sorry, Health Insurance Portability and Accountability Act, the green square there at the end. I got a lot I'm trying to manage here on my presentation. So as you can see, the majority of organizations don't understand what HIPAA compliance actually stands for. We are okay with that. It's what we're here to help you work through today. Just to tell you a little bit more about who we are at Abide, we're a technology company. We're comprised of HIPAA compliance experts, where we differentiate ourselves. And the reason why ChiroHealth was so excited to work with us, as you mentioned, Christy, is we provide HIPAA education and solutions that are specific to your environment, right? That are specific to the chiropractic office environment, which is very unique. I know you can appreciate how unique your environment is. I know that those that are on today's call are all wearing different hats on a regular basis. I know we have a wide array of job titles and practices and wide array of job titles and practice responsibilities on the call today. So to get you better acquainted with the others who are listening, I want to just take a minute to give you all an opportunity to give us some feedback as to what your responsibilities are within the practice. And I'll give everybody an idea as to who's joining us today. So again, question number 2 that we have for you, utilize the Kahoot.it on your phone. What best describes your main responsibility at your practice? Give you just another couple seconds to answer, and then we'll get going again. So as I mentioned, you're probably juggling many different responsibilities on a daily basis, including trying to manage a HIPAA compliance program. So at Abide, we understand that. We work with practice owners, doctors, office or business managers, other staff each and every day all over the country. We understand your struggles that you have. Since the chiropractic industry is a unique industry, this presents a unique problem when talking about HIPAA. So you see our agenda here that we'll go over. A lot of the other educational webinars out there are geared more for enterprise level organizations such as a hospital. But at Abide, we provide education from the chiro industry perspective. All right, so your environment is much different than that of a hospital's, right? You don't have a CIO or a CTO or even a compliance team that are full-time HIPAA experts. And we understand this is precisely the reason why ChiroHealthUSA wanted us to educate you today. And so education is our priority at Abide. First, we're going to go over today the state of HIPAA compliance. We'll discuss some of the recent trends, show you what the forecast looks like for HIPAA as we move further into 2020. We'll also lay out the steps involved in becoming HIPAA compliant. So if you understand what the privacy and security rules require your practice to accomplish, then you have a great idea of what your HIPAA compliance action plan needs to look like. We'll then go over the current government-led audit programs that are in place, help you identify who's at risk to be audited in each program. And as a last-minute addition, literally last minute, because we just got some more information coming down from the president just a couple hours ago, we'll review how the COVID-19 virus is impacting HIPAA and patient security and privacy. I mentioned, there's new information coming in, almost seems like on the hour now. Finally, at the end, special treat to kind of ease some of the pains for you when it comes to HIPAA compliance. The other reason why ChiroHealth has chosen to partner up with us. And it sounds like an oxymoron, but we can actually show you how to solve their problems with HIPAA and enjoy stress-free HIPAA compliance with our revolutionary software solution. So beyond our industry-leading education, we have an unrivaled solution for HIPAA compliance. So let's go ahead. Let's get started on the educational aspect. I think that's important to set the basis and give you all a great idea as to what's going on with HIPAA. How do we get here? Or you may be asking yourself, how do we get to present-day HIPAA compliance? Why is it so important? Maybe you've heard more about recent HIPAA enforcement actions even before the coronavirus came about. But why now? I mean, HIPAA's been around for 24, 25 years now. Why all of a sudden is it now coming to the forefront? The simple answer to that is technology, and really the evolution of technology within the healthcare industry. And because HIPAA sits at the intersection of healthcare and technology, I think everyone can understand that HIPAA is not something that will soon go away, right? It's really a misconception we hear all the time that HIPAA is not going to be around beyond a specific period of time. That's not the case. And in fact, as we take you through the webinar, you actually be able to see that this is just the beginning. We're actually just getting started with HIPAA enforcement. And so if we go back a little bit to the mid-90s, all right, and understand that the government noticed the trend of technology becoming a more prevalent aspect in everyone's lives. They knew that healthcare was not going to be immune to that. So with the implementation of technology, government understood that someday medical practices were not going to be using paper records. And because of this, they knew that sensitive information like names, social security numbers, dates of birth, medical history would now be stored on practice management EMR software, which is typically accessed through devices like computers, phones, and tablets. All right. And so just as a side note, the sensitive information that you're storing and you're accessing within your practice management EMR software or any other type of software or database that you're using to track patients, whether it's seeing patients or booking patients, is 10 times more valuable on the black market than any credit card information. And so no longer does someone who has malicious intent have to physically be in your practice to take the chart off the wall or out of a filing cabinet. They wanted to steal information. Now they can use technology, right? Sensitive patient information is now just as accessible to someone thousands of miles away, really, as it is to someone who's walking into your practice right through your door. And I think everyone on the call can understand this is kind of a bad word to use nowadays, but really it's an epidemic of data breaches, right? And the complications that are associated with them. So the massive rush in healthcare practices adopting practice management and EMR solutions, along really with a plethora of other technology, is precisely why you have seen an enhanced focus on HIPAA compliance. It's a pretty bold statement we make here on this slide. We estimate that about 85% of practices, chiropractic offices, general medical practices, eye care practices, dental practices, are not HIPAA compliant. So specifically, 85% of practices are not complying with the government's regulations. So I want to clear that up a little bit for you, because I don't want you to necessarily take offense to that, because it doesn't mean that the large majority of practices out there aren't trying to protect patient-sensitive information. It really just means that 85% of practices are not complying with the government requirements. So there's a disconnect there, right? As we go through the webinar today, I'm actually going to help you bridge the gap we're talking about and lay out those steps to HIPAA compliance. And so we've got another update on our slide presentation here. So I'm just going to pause again, refresh my screen and my slides. And we have some results from the question of who has joined us today. As you can see, a large majority are providers out there, so we appreciate you taking out time, and office staff, and then also have some non-doctor practice owners that have joined us. So thank you all for joining us today. And again, hopefully this provides a little bit of information for you as to who else has joined from your industry. There are two main reasons to a large lack of compliance that we see at Abide, right? The first is education. We're going to go through that today with you as well, but you also have little time to address HIPAA compliance. We kind of talked about it before, right? The different hats, the amount of things that you're juggling on a daily basis. So if you look at how your time has stretched across a numerous amount of daily responsibilities in the chiropractic environment, you really have many other priorities and stressors that take your focus and energy, right? First and foremost, worried about patient care and building profitability, and then everything else that comes with having a medical practice. And so when it's all said and done, there's really no time left to decipher and execute upon complex HIPAA requirements. We understand that. And so if we're lucky, HIPAA's jammed, somewhere on the low end of your totem pole, right? Easily gets lost, or it's the can that gets kicked down the road. It's one of those things that eventually, you say you're going to get to, but it ultimately never gets the attention it deserves. So that's why we're conducting this educational webinar today, to enlighten you as to why we want you to move HIPAA up your list, why you need to move HIPAA up your list of priorities, and make sure that you have a plan in place to comply with HIPAA requirements going forward. As I mentioned, the lack of education is a big problem, and so that's where we're going to start right now. Take a look at 2019 year in review, why it's important, what went on. No one really, has taken the time to give this to you from the chiropractic perspective. We understand that. So if you look here, there are two different entities governing HIPAA compliance. The first is the Office for Civil Rights. So last year, the Office for Civil Rights had their most active year ever. They hired new investigators. They updated websites. They provided new additional guidance documentation. There were new laws enacted. They made it a focus to enforce patient right of access rules. These are all things that they implemented in 2019. They also encouraged states to enforce HIPAA compliance. We saw an uptick of that last year as well. You also have CMS, right? I know a lot of you are not part of the Meaningful Use or MIPS programs, but I bring it up because there is a proactive audit program that goes along with each of those. And because there's a HIPAA compliance aspect to it, this is another way that the government can audit for HIPAA compliance. And so we want you to understand that HIPAA compliance is showing up all over the government's radar, and it's really just a matter of time before it impacts your practice. This is a pretty interesting slide here on your screen. A huge increase in patient complaints over the last few years. The quick answer as to why we've seen that is because your patients understand your responsibilities as a provider. They understand that you have responsibilities and requirements specifically around HIPAA compliance to secure their information. And we're all patients somewhere. We all want our doctors to be implementing compliance programs that meet government regulations. And so just understand that your patients are paying attention to what you do or you are not doing to secure their information. So the government has seen a large increase in HIPAA compliant complaints. Say that 10 times fast. In addition to that, taking a look at this slide, we'll hammer home the fact as to where the government's focus has been around enforcement the last few years. So this is the overall time frame of enforcement for HIPAA compliance for the government. You can see that 73% of the total enforcement activities were just in the last 4 years. So I think we can all appreciate that if the government drills, they find oil, what are they going to keep doing? They're going to keep drilling, especially if they feel like they're doing the right thing by holding medical practices accountable for securing protected health information. You might be asking yourself, well, who was fined? And as you can see on this slide, the government doesn't differentiate between large organizations or a physician's practice when it comes to fines. In their mind, all sizes of and types of healthcare organizations are in their crosshairs. So our third question that we have here is a question we'd like for you to answer about how your practice is currently addressing, or maybe what statement best reflects how your practice addresses HIPAA compliance. So you can see the options there. There are no approach, not really sure where to begin, and that's okay. Maybe you feel like all the software products and solutions that you use are HIPAA compliant, which absolutely might be the case. Go through training, or do you have a comprehensive and thorough documentation or compliance program that is documented per the government standards? So we'll give you a second here to answer, and then we'll move forward on talking about maybe some common misconceptions that you might have around HIPAA compliance, and then getting into our definition on what we feel like it truly means to be HIPAA compliant. All right, I'm gonna go ahead and move forward here. Some common misconceptions that we see here on your, you can see these on your screen. Maybe you feel like you're HIPAA compliant because your practice management EHR product is HIPAA compliant, and that's important, but it is just a small piece of the puzzle. We'll talk about that. We also hear a lot of times around IT companies, right? Our IT company takes care of HIPAA. You're gonna see there's a lot more that goes into HIPAA compliance than just the technology side of things. There are physical and administrative safeguards that you must be complying with as well. Obviously, having a secure environment is important, but these are really all just pieces of a full picture that need to come together and be documented appropriately to consider yourself compliant. We'll talk about that here in a second. Let me just jump back. We're going to update with those answers on how your practice addresses HIPAA compliance. Give me 1 second. We'll go grab those answers. We'll share those with you. All right, so as we take a look here, looks like 62% are in the blue category. All the software and products we use are HIPAA compliant, and that's great. And I appreciate the feedback and the honest feedback here. HIPAA training and a comprehensive and thorough documentation in second place there, and 8%, again, appreciate that honesty as well. Not really sure to where to begin. And we're going to lay it out for you today as we go through the webinar as well and give you all that information you need. So just a really good idea as to where everybody stands, and we'll talk about some of these results as we go through. Now, here's our definition of what it truly means to be HIPAA compliant. And so it's documented proof that there's a culture of compliance within your organization. And so when you go back to those common misconceptions, or even some of the answers that we allowed you to provide us on the previous screen, all of those are proof that there's a culture of compliance, but are they documented appropriately, right? And so most organizations have a great culture of compliance, right? You have locks on your doors, and you're making sure that you're not talking about patients in front of others, or you're using practice management EMR solutions. But how do you prove that to the government if there was ever an audit or investigation into your HIPAA compliance program? And that's what we're here to maybe change your perspective a little bit, because it's a lot like taxes. So if you think about HIPAA, you go through the next few slides, thinking about HIPAA a lot like taxes, right? You can pay your taxes every year, but without the correct documentation, unfortunately, you can't consider yourself or your organization compliant with the IRS standards. And so the same thing goes for HIPAA. You can have a great culture of compliance, but without documented proof, the government's just not going to take your word for it. And so a lot of times this gets attention of our webinar participants because it's a completely different way of thinking about HIPAA, as we just showed you on the previous slide with your answers. So here's how most providers view HIPAA compliance, right? Let's just make sure our environment's secure, that everything that we're doing is HIPAA compliant, all the vendors that we use are HIPAA compliant. But ultimately, this is how the government views HIPAA compliance, right? So when you look at it through the lens of an auditor, you see it consists of multiple pieces pulling their own weight, coming together to document appropriately that culture of compliance. No piece is necessarily any greater than any other piece, right? And without one of the pieces to the puzzle, you don't have the full picture. And so we're going to dive in and pick this puzzle picture apart and give you an idea as to how all of these need to be documented appropriately, so you can really prove to the government, not when, but if, or I'm sorry, not if, but when your practice is called upon their HIPAA compliance program. And there really are three different ways that you would be investigated by the government. So just keep in mind, right, how likely is a proactive audit? Not very likely, although it is likely, and we'll talk about that here in a minute. There could be a data breach, right? So nobody's immune to a data breach, right? We've seen that with some of the really large organizations that have been breached just recently. In addition to that, patient complaints. So those are the three different ways that your organization can be investigated. And everybody that's joined today's webinar is really susceptible to all three as of today. So the first piece of the puzzle is probably the most important piece, right? If you can't get the first piece in the right spot, they're not going to go any further in their investigation. And so there is a first step to HIPAA compliance. It's the risk analysis. It comes from the security rule. You can see at the bottom, this is from the government website, and is just to show how confusing the HIPAA is. This is 11 pages deep on the government website just to find this information. So hopefully you see a lot of value in the information we're pulling together here for you, because that first step is vital in the case of an audit. You can see at the bottom, the outline that is the first step. I'll go ahead and read the requirement for you. It's to conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of the electronic protected health information held by your organization. So what in the world does that mean? Well, in layman's terms, it's a self-evaluation where your practice goes through and identifies within those three categories of safeguards you see on your screen, and you document what safeguards you have in place, but then you are also to document what vulnerabilities or safeguards you don't have in place. And this is where HIPAA really starts to present a challenge to the independent medical practice environment. It's why we developed our software solution, Abide, because even though you know the requirement now of the risk analysis, executing it is a completely different story, right? If you understood right now that there was a vulnerability when it came to patient privacy or patient information within your organization, what would you likely have already done? You would have already implemented a solution. We understand that at Abide. It's why, again, we developed our solution. But just because you don't have a full-on compliance team, or a CIO or CTO, or you're a staff member that's doing 10 other things, or a doctor that's focused on patient care and building profitability, just because you have those responsibilities within your organization does not exempt you from these requirements. These are the same requirements as a hospital, although they can be modified within a reasonable aspects. So maybe it's not as comprehensive of a risk analysis as a hospital's, but still the requirement is there. In the case of an audit, it's the first thing the government will ask for. And so ultimately, you can't say that your organization is HIPAA compliant without a documented and comprehensive risk analysis. And so this is going to be a pretty telling question here. We want to know, has your practice completed a comprehensive risk analysis within the last 12 months based off of what you know from the previous slides that we just shared with you on what it truly means to be HIPAA compliant? We'll give you just a minute to answer, and then we'll share those answers with you as we go forward. All right. So let me go ahead and grab those answers for us. All right, so it looks like the majority understand its importance, and it's at the top of your list, which is great, and we appreciate that. 25% are the outliers. We call you all, I guess, the Vegas. It's the Vegas method of running your practice, right? You have the opportunity to roll the dice. We hope you don't find out the ramifications that, risk analysis was what was necessary to pass an audit, but hopefully your tune will change as we go forward, especially after you see our solution. Love those that don't know, but you're going to find out, which is great. It's, big takeaway is, have we completed our risk analysis? Ultimately, if it's something that you've been through, you probably know it. So that's where we say, if you don't know if you've been through it, then you probably haven't, because it is pretty painful, especially as an independent practice. And then 17% have conducted it. That's actually pretty unbelievable, because some of the statistics that I'll share with you from the most recent audit program for the government shows that only 17% of organizations, or in their words, 83% of organizations, did not have a risk analysis that met the government's requirements. So 17% did, and that's what we have here on the presentation. So I think that's pretty interesting and pretty telling that our numbers are probably pretty accurate here as well. This is for those that said it wasn't on the top of their radar, or the top of their list or on their radar, this is coming right from the Office for Civil Rights Director Roger Severino. Says neglecting to have a risk analysis that's comprehensive is really a recipe for failure. And we'll just leave that there. So there are two different phases to HIPAA compliance. The first phase is the security rule, okay? So that's the risk analysis requirement. The rest of the puzzle pieces cover the privacy rule. So in so many words, the privacy rule ultimately states that your program or your compliance program must be ongoing, it must be proactive, and it must be documented appropriately. Included in that are these puzzle pieces that we're showing you here. So we're going to go through these for you. The first thing the government wants you to do after completing the risk analysis, it kind of makes sense, right? They want you to mitigate the risk. They want you to identify vulnerabilities and then implement solutions to mitigate your overall vulnerability within those areas within reasonable circumstances. HIPAA training must be conducted at minimum once per year for all doctors and staff. Okay, this must be done in a module type format, which means that your organization needs to have a quiz at the end and needs to be documented appropriately as well. All new staff need to be trained at minimum within 30 days of coming on board. That's our recommendation, again, with a quiz part of that as well. Policies and procedures is an area that we hear a lot. Different practices tell us, oh, we're HIPAA compliant because we bought our policies and procedures. We downloaded them online, right? So I caution you against that if that's your scenario. Reason being is they need to be specific. So we do hope that those policies have been updated, have been made specific to your organization. Again, if you think about it like taxes, the security risk analysis, the security rule risk analysis is very similar to your tax return. It's kind of that big documentation that shows your overall compliance. And then policies and procedures are all the supporting documentation, receipts, and other documentation that you need for tax purposes. So these provide supporting documentation to what's found on your risk analysis. And if they don't back up what's on your risk analysis, then ultimately that's going to throw up a red flag to the government. It's like providing generic receipts or generic tax documentation in the case of an IRS audit. It's just not going to fly. A lot of practices tell us they get their patients to sign authorization and consent forms, and this is great. This is a big piece to the puzzle, although it's just one piece, but these are definitely important to make sure that you're getting your patients to address those. HIPAA manuals, again, we hear a lot, oh, we're HIPAA compliant. I've got my HIPAA manual in the corner. Ultimately, we call it a dust collector or a paperweight because it never gets used. Really, a HIPAA manual, I'm going to make a really corny dad joke here, but a HIPAA manual is a lot like people, okay? It's what's on the inside that counts. And so just having a manual of generic documentation is not going to get you anywhere, right? So it needs to have your specific policies and procedures. It needs to have your risk analyses. It needs to have your documented compliance program as we're talking about it here. By the way, we also recommend that your HIPAA manual is electronic at minimum, right? Just in case you can't go into the office for whatever reason, or the office, something happens to it physically and you only have a physical binder to access all of your documentation. It's ultimately like, backing up your EMR software. You want to have remote access to it. So making sure all of your documentation is stored electronically is vital. Business associate agreements is an area we get a lot of questions in. Hopefully you understand who they are, what they are, their functionality. In short, business associates are organizations or people that have access to or potentially have access to your protected health information. And these people or these organizations also must provide services on behalf of your organization or your covered entity. So in layman's terms, really a business associate is someone like an IT company, right? Who's not automatically, because they're an IT company, they're not under the HIPAA umbrella. But once they start working with a covered entity, someone like your organization or your practice, they are considered a business associate and they fall in line, or they are supposed to fall in line with HIPAA requirements, which means they too should be doing all these things that I'm addressing with you today. They need to have a risk analysis. They need to be doing training. They need to make sure that what they're doing is ensuring the privacy of the information they come into contact with within your organization. Some other examples may include an accountant, an attorney, third-party billing companies. These are all organizations that are considered business associates. And agreements, signed agreements, must take place. And these agreements really offset the liability in the case of a data breach. So let's just say the IT company comes in, does some work for you, stores some sensitive information on a thumb drive. They load it back all onto your computers, but there's still the sensitive information on that thumb drive. They take it home. For whatever reason, the thumb drive is misplaced. That information is compromised. Was that your practice's fault that happened? Absolutely not. But are you under HIPAA responsibility to make sure that that information is secure? Absolutely. And the way that you do that is get these agreements in place. So therefore, your practice will not bear the responsibilities and the enforcement actions of the government. We've seen this all too often just in the last couple of years. Lack of business associate agreements, we even have some examples for you, can ultimately sink your organization. And then the final piece to the puzzle, the risk analysis. It's a never-ending, ongoing process. You may have seen that on the original risk analysis slide that I shared. So we think about it like a resume almost. There should be no gaps. It should be touched continuously, and it should show where you've been, where you currently stand, and where you plan on going in the future. So any good documented culture of compliance looks like this. All of the pieces documented appropriately, coming together to show there's a culture of compliance within your organization. I hope that clears a lot up for you. I know there's a lot of information. Just keep in mind, we're always around to answer any specific questions you have as well, even after the webinar. Maybe asking yourself though, but is it really real? Give me some examples of what we just went over. How, if I don't conduct the risk analysis, or if I don't have business associate agreements in place, how can that affect me, or how has it affected practices in the past? And so let's go over that now. So these are either through complaints, breaches, or audits, these investigations. As I mentioned before, those are the three different ways that the government can come in and assess your compliance program. This is from end of 2018. An employee was terminated by this organization in Colorado, but still had access to protected health information. While they had access, the information was actually compromised and put on an outwardly facing website. This happens. It was an accident, but it happens. It affected 557 patients. But look at the fine amount, $111,000 just for 557 patients being affected. Why? Well, they didn't have employee termination documents and policies, right? For offboarding employees, making sure they know who had access to PHI and how they had access. They didn't have any of these policies and procedures in place. And so while they probably stated their case that, hey, this was against the procedures and the policies within their organization, because it wasn't documented appropriately, the government didn't take their word for it. So make sure that your organization has this documented and that it's actual steps that your practices take on a regular basis. The next example was just at the end of last year in October of 2019. It's a smaller practice. It's why I wanted to share this example with you. It was a dental practice. It was a $10,000 fine. And ultimately, all they did was respond to a patient complaint on social media. All right, this is very important to understand. We highly recommend avoiding responding to patients in a specific way. We recommend a general canned response, regardless of what the complaint or the question was on a review or on an online forum. So just have this canned response that really points them to calling your practice and contacting you directly. Having these discussions in an open forum online, it's not the place. So make sure that also that you have documented policies that address social media and disclosures, even having maybe a media disclosure form that you get your patients to sign to make sure that they understand their responsibilities and their rights around securing their information being used for marketing purposes and stuff like that. The next example is actually from an organization very close to our home office in St. Pete. This was I mentioned it before, this was a really a strong focus of the government for the patient right of access. Really, patient right of access means that you as a covered entity have laws to comply with in terms of time frame when a patient requests access to their protected health information. So in Florida, the law was, after this patient requested access to her information, she was a pregnant mother, the organization should have complied within 30 days. That's the state law for Florida. A lot of times state laws come into play, especially with this patient right of access. So I do recommend you look at your state laws. Some states like California, it's 10 days. Other states, it could be 45 days, it could be 15 days, it could be 60 days. So look into your state law, but this is a real focus for the government going forward in 2020. You can see it was just a single patient complaint that wasn't complied with, and $85,000 later, there was a HIPAA enforcement fine. So make sure that you know those state laws. Also understand it only takes one patient. I know we said before, the 557 patients, $111,000 fine, $85,000 on this one for just one patient that was affected. All right. So now some new information around some present day activities going on with this COVID-19 virus and understanding how HIPAA and privacy affects the virus. The government obviously has outlined this as a public health emergency. So there are still limitations around securing this information. Although I say this with a caveat, 2 hours ago during the presidential press conference, they mentioned loosening, the Department of Health and Human Services loosening some privacy and security protections, HIPAA protections around how you address patients remotely. So we'll jump into that here in a second. But just make sure that, the individuals that are at risk of contacting or spreading the disease are limited with the information that you share with them. Make sure that, this is information that a public health authority that's only authorized to collect PHI that's relevant to the control or spread of this disease. So the CDC, so if you come into contact with a patient, you're going to want to reach out to either a local or federal health organization. Ultimately, the CDC is accepting these as well, but we know they're also inundated. So even some local health organizations might be able to help you out through this process and alerting patients that may have been in contact with, if there was a patient that came into your organization that became infected. Do know that you can, provide information to disaster relief organizations that are assisting in relief efforts. That doesn't necessarily apply to the coronavirus, but sometimes in hurricanes, wildfires, earthquakes, that can be the case as well. Do note that HIPAA law and the Office for Civil Rights, they really defer to your judgment as a health professional about the nature and severity of the threat when determining if this information can be shared. Obviously, if there's an imminent and immediate threat, you want to make sure that information is shared responsibly. We do recommend as well that, don't disclose patient information to the media or the public at large without patient's written authorization. But you do, as a provider, have the authority, you can see in note number 1 here, to defer to your judgment on how to best handle this. If you do feel like it's an immediate situation or an emergency situation, you might be able to go beyond the limitations of what generally is accepted within HIPAA compliance. At all times, we recommend that you provide the minimum information necessary. That is a rule that is ingrained into HIPAA compliance. It's an actual rule. It's the minimum information necessary rule. In all cases, and this is emergency cases or in general cases, you are only to allow for the minimum information necessary to be provided to get either the job completed, get the treatment completed, get payment completed, or keep up with different operations within your organization. Telehealth and HIPAA, this is where they relaxed a little bit just within the last couple hours. We don't know the full scope of this, so if you are doing any type of telemedicine right now, we do recommend that you use a secure platform still, a secure messaging service. A lot of EMR solutions have messaging services built within them, the patient portal. Utilize those. Those are all HIPAA compliant solutions, but it does sound like, and don't quote me on this because they haven't come out with anything official, although we've been on this webinar now for a little bit. But they may give you the ability to bypass some of those security protections and communicate directly on a cell phone via text or maybe FaceTime, which originally or typically are not HIPAA compliant solutions. So it's an audit program. Two key takeaways here. So just understand, again, these are rated inadequate or worse. 83% of those that they audited did not perform a risk analysis that met their requirements. So as I mentioned before, that was exactly the same percentage that will increase as we go forward. Just as you have, just to give you a little bit of perspective, the $10,000 fine that we did within a year, we highly recommend that you update it, touch it on a regular basis. So who's going to be charged of that? How are you going to draft all the other documentation, policies and procedures, business? If you're sitting here going, how in the world am I going to address all these requirements? We're here to help. But ultimately, the question that we ask yourself, or we recommend, protected in the case that your organization goes through an investigation. So our practices are happy to say with Abide, they email, and then they show as a drop down that you can see here with your notification bell. Guard categories. We've also simplified the questions. So a lot of practices out there call Abide TurboTax for HIPAA compliance, because these are just super easy, yes, no, even if you don't know the answer. And so this actually ends up being customized or tailored to your organization, because depending upon how you answer the question you're answering at that point, that will determine the follow-up question that we push to you. So you're not going to end up answering a whole bunch of questions that don't pertain to your organization. And so it could be anywhere between 65 to 85 questions, just depending upon what your practice has going on within its environment. Once done with the risk assessment, we drop you into your scorecard. And we immediately give you a great idea as to how you stand versus best practices, especially where it comes from the chiropractic industry and not necessarily from an enterprise level environment. And so quick kind of an example of that here, I'm just going to change my answer. But does your office have a signing log for visitors, those that are not patients? You can see we've identified the answer of no as a medium risk, okay, right there in the middle. Now, if this was a hospital, that's a very high risk over here on the right-hand side. So if you scroll over the exclamation point, we actually give you ways on how to mitigate your overall risk or address that specific area, implement a solution that would obviously drive your risk down. We let you know here as an independent medical practice, it's not mandatory, doesn't mean that you're not HIPAA compliant, but it's highly recommended, okay? And at any point, you can come into your risk assessment scorecard, adjust your answers, and immediately it will adjust your risk level. Also takes away any recommendations we provide you as well. Any answer that you flag or you answer as don't know, we flag that as a very high risk. That's how we make sure we don't let that slip through the cracks, and we'll address that in an ongoing capacity. I'll show you that here in just 1 minute. And like TurboTax, you fill in some profile information, you answer these questions, and Abide dynamically generates all the information that your practice needs to be HIPAA compliant. And so you can see here, this is what a risk assessment scorecard that will be prepared by Abide for your organization. It has today's completed date on it, right? So it's completed today because I hit the PDF button right now. So it's going to timestamp the most recent date on it. This is a great way to prove kind of up to the second status of your compliance program. This is ultimately what you would send to the government first in the case of an audit. has all of your notes in here as well. So if there are any, exceptions for any of these recommendations or any of the higher risks that we have, let me just switch my screen back over here. Sorry. We'll make sure we document that as well. And now I have lost abide.com. There we go. We're back. All right. You can filter in this area as well. So identify any of your low, medium, and high risks, and also filter from any of the safeguard categories that you see here on the screen. So that's the first step. That's the biggest step for HIPAA compliance. We make it super simple. It takes about 30 minutes. And then from there, it's just an ongoing process. And so the majority of your notifications are going to be to answer ongoing compliance questions. All right. And these questions are really follow-ups to what's on your risk assessment. So we help you identify and stay in front of you and make sure you understand that there still is a high risk for your organization. And then we want you to address this risk. Now we send you high risk questions, very high risk follow-up questions more frequently than we do your low and your medium risks. But since you're answering, 5 to 15 questions a month on an ongoing basis, this avoids having to go through that full risk assessment ever again. So those that have been through it, how nice is that? Not to have to go through that full risk assessment again. In addition to that, if you change an answer on your ongoing compliance question, it'll automatically correlate back to your scorecard. It adjusts your risk level, change the frequency of a follow-up question. And so ultimately, we talked about it, right? Your compliance program should be this evolving, fluid situation. Almost your risk analysis should really be a living, breathing document. And so on a monthly basis, it's going to be addressed. Answers are going to be implemented or changed. And because of that, Abide will timestamp and document a risk analysis scorecard for you at the end of each month. And so you're actually able to pull, if you were ever audited, a lot of times it can be for a specific quarter or maybe a specific period of time. You'll be able to pull a risk analysis from 1 month on either side of that date. And that goes, again, a long way in showing that not only is HIPAA compliance important today, but that it's been important, obviously, ever since you've been utilizing Abide. As I mentioned, policies and procedures can be really tough for any organization to draft and to keep those updated. Super simple with Abide. Answer profile information, answer questions, and we dynamically generate right now 30 different policies and procedures that are specific to your organization. And so we're literally drafting these based off the answers that you give us. So sentence by sentence, paragraph by paragraph, the whole policy could change depending upon how you answer your questions, which is exactly what's supposed to be done. But the beauty of it is all you're doing with Abide is answering those ongoing questions, and we take care of the rest. So if there's a change in staff, that immediately, once that change is made in your profile section, it's immediately changed within all of your procedures as well. And so you can rest assured that as long as you're staying up to date with your questions, which we're going to notify you on, as long as you're updating your profile, which we're going to notify you on, that all of your documentation will be as up to date as possible. Our customers love it. It saves them anywhere between 30 to 50 hours a year managing policies and procedures. Oh yeah, by the way, these are drilled down to your state law. And so really dependent upon the state that you are in, we'll make sure that we have the policy specific for your state. HIPAA training is an area of not only concern and focus, but of hassle and headache. We make it really easy with Abide. So we notify all of your staff when training needs to occur. So anybody who has an email address within your profile section under your staff will receive an email from Abide when it's time to go through your training. These are training videos. They're no longer than 15 minutes in length. We try to make them as engaging or entertaining as we possibly can. But ultimately, this is information that they're going to be able to utilize within your organization, because we're coming from the independent practice environment. It's information that will be useful. And we really try to provide it in an engaging format, an entertaining format, to make sure that your practice and your staff is paying attention. We do have specific trainings then for the HIPAA compliance officer as well. But once they go through the training, they'll also be able to take a quiz. And these are links that they can utilize and conduct this training remotely, so they don't have to be in the office to do this. They can also take the quiz remotely. They can do it from their phone if they want to as well. And so there will be specific quizzes that they need to take. And upon completion, we do provide a certificate that shows that each employee has been through the training. We identify which training it was that they went through, has their name, the training, and then obviously the date that it was given. So we make it super simple, no having to shut down, the office or get everybody together during lunch, chase people down, come up with content, come up with quizzes. Abide will do that for you. The last little area I'm going to show you before we go through pricing and answer any questions. I know we're running short here on time. Business associates can be done really easily with Abide. We have a business associate portal. Kind of works similar to what I was just showing you with the employees, although this is done manually, where you can sign, send, and automatically receive completed business associate agreements through Abide without ever leaving the software. And so now here, ChiroTouch has a business associate agreement sent from our practice. It's electronically signed by our practice. They would then get into our Abide's business associate portal, electronically sign it and send it back. Once completed, the PDF is available for your organization to see, and you'll see ultimately that we dynamically generate all of this information for you as well, all the way down to practice information, state information as well, the business associate information. And then on the final page, we have the doctors, whoever signed it from your practice, their name, the date it was signed, and then the electronic signature, and the same goes for your business associate. So super easy. If you were kind of scratching your head wondering how you're going to get these done, our business associate portal is really unlike anything else out there. There's no other software that provides a portal to get their business associate signed electronically. In addition to that, there is no other software out there that dynamically generates your documents for you. So we are the industry leader. We make HIPAA compliance super easy. Follow the notifications, answer questions, update profile information when prompted, and you can rest assured you're HIPAA compliant. The last little area I'm going to touch on, we have a white glove service as well. So not only do we have a great HIPAA software solution, but you can gain access to our support team, whether you're audited or breached, or at any point you have any specific questions around HIPAA compliance. But when it comes to audit or breaches, we'll walk you through that process. We're happy to say no practice that we've ever worked with has ever given a penny over to the government. Just got word back a couple weeks ago. We just passed another audit with another happy customer that had a laptop stolen. The government came in and audited, and we passed because of the documentation that we had within Abide. But what did they do first? They signed up. They signed up before there was an event. And so they had been using Abide for over 1.5 years before the issue occurred. And that's what I challenge you all to do today, is to act. Whether you use Abide, whether you do something on your own, we really recommend that you implement an action program because it's in a compliance program, because it's only a matter of time. So I'm just going to go over quickly here, just some pricing, some general pricing. You can find this on our website at any point as well. It's based off a number of locations and then total number of employees. So the average chiropractic office that we see, one location, 1 to 5 employees. It's a yearly agreement. You either pay monthly over the course of that year, or you can pay upfront for the year. If you do pay upfront, we do provide a 10% discount for paying upfront. In addition to that, we're also providing a special for today's webinar where you have the ability to save 25%. We're going to give you 3 weeks to save 25%. I just want to make sure that I give you the correct code here. And it's HIPAA-USA is the code. All one word, HIPAA-USA, as in HIPAA, ChiroHealthUSA. Let's see. Just need to share my screen again. Give me 1 second. I'll show you that promo code. So you can see what that drills your price down to. 25% discount if you have 1 to 5 employees, one location, brings it down to $86.25 a month. You're talking about about $2.70 or 80 cents a month, or I'm sorry, a day to manage your compliance program. I mean, it's pennies on the thousands of dollars when it comes to the ramifications for not complying. If you did want to sign up and pay up front for the year, you do get the additional discount on top of the 25% discount for attending today's webinar. Again, that promo code is HIPAA-USA. It's a 25% discount. And I will just show quickly what it looks like for those that have 6 to 10 employees within their organization. So $1134 for the year. If you paid up front, bring it down to about $105 a month for 12 months. So at this point, I'm not sure how we're going to open it up to questions. Christy, I'll defer to you on that. I don't know if you want them to utilize the chat feature or microphones, whatever works best, but we'll make ourselves available for questions.
Okay, our first question, if you'll submit them through the chat feature, everybody. And we're only going to have about 4 minutes. But the first one is, what is the procedure to providing medical records to patients if they call on the phone?
Let's see. What is the Connie says, what is the procedure to providing medical records to patients if they call on the phone? You need to be able to verify that it is the patient on the phone. Obviously, maybe walking through just a couple verification questions to make sure it's them, social security number, something like that. But you can provide them information over the phone, obviously, if it's theirs and they're the patient.
Great.
Scroll down. Let's see. Says I work part-time, 25 hours a week, and have one independent contractor that does follow up insurance. Where do I fit in terms of I'm guessing how many pricing? If you do just have yourself or maybe 2 employees, I recommend that you reach out to us. You can find our contact information on our website, abide.com. And you can reach out to us. I'll show you that here. And we might be able to work something out with you for your practice. A lot of times we understand some of the economic constraints around a smaller practice like that. What if we're waiting for a clinic to be built and it won't be done for 3 to 4 months, but want to take advantage of this opportunity? Great question, Ryan. If you don't mind, reach out to us directly. And we'll make sure we try to maybe get your information as well. We'll do our best to save this for you. Appreciate your interest and wanting to do things the right way before you open up.
Is there a HIPAA law or rule about emailing patient medical records?
Law about emailing patients' medical records with encrypted content? Yes. So it says in terms of transmission of protected health information, it must be encrypted both at rest and while it's in transit, which means if you're emailing something that is in transit, it needs to be encrypted. When it's in your protected health or it's in your EMR solution, it's already encrypted. So that's when it's at rest. But you want to make sure that in transit, when you send that information via email, that is also encrypted. You have 2 employees and 1 doctor. How much would your cost be? Again, if you just jump on our website and go to sign up or the pricing page, you can get to it either way. 1 location and then all employees. So this includes doctors, full and part-time as well. So total number of employees, you can see your pricing there. And then obviously 25% off of the $115 for the HIPAA USA pricing.
Okay, guys. Well, it looks like that is about all.
Form would be incredibly helpful for Shannon. Shannon is very easy to do business associates on our website. Otherwise, it really is tough to find a business associate agreement online that you're sure meets the government requirements. So we understand those struggles, but we'd love to help you out and have you utilize our solution to make that as easy as possible.
Okay, everybody, can y'all hear me? So I just wanted to let y'all know that we're running out of time, so we're gonna have to close. But Matt, what's the best way if they have additional questions after today's webinar to reach y'all?
Yeah, that's a great question. So if you go to our website, click on the contact us form. This goes out to really everybody in our organization. We'll get right back to them. Give us a call. You see our phone number on here as well up at the top, 1-800-594-0883. We'll answer the phone as well. So we have in-house consultants that are available. But any questions that you have, it's not a problem. We also have direct info at Abide email address that you see there on your screen. So there are many different ways to get in contact with us, and we're here, we're all ears.
Thank you so much, Matt. And thank you to everybody for joining us on the webinar today. I encourage you again, go to their website. Sorry, I'm like trying to balance this so it's not like looking at my nose. But thank y'all so much for being here and participating. Go to the Abide website at abyde.com. Check it out. Listen, I've done the demo with them. I've played with this software, and it is the stuff that dreams are made of. Because trust me when I say that when Chris said this is HIPAA made easy, y'all know me, I'm a skeptic. I'm like, yeah, HIPAA easy, but it really is. It's a pretty incredible program, and it's the way to do HIPAA. So check them out. They're incredible, wonderful. Will answer all of your questions. They will definitely make your life in HIPAA compliance so much easier. And don't forget, whether we're all sitting at home on Corona vacation or not, next week is Dr. Mario Fusionary talking about revenue cycle management. Then we're going to be talking about busting the myths of retirement with my good friend Bob Bove at the end of the month. So, ladies and gentlemen, be safe, wash your hands, observe social distancing. Yes, don't forget your disinfectant wipes.
Yeah.
Have a fabulous day and a wonderful week, and we will see y'all next time.
Thank you all for your time. Be safe. Thank you, Robin. Thank you, Christy.